Welcome to Smart from the Start, presented by Care AI, the smart care facility platform company, and leader in AI and ambient intelligence for healthcare. Join Steve Lieber, former CEO of HIMSS, as he interviews the brightest minds in the health provider space on truly transformative technologies that are modernizing healthcare.
Hello, and welcome to Smart from the Start. I'm your host, Steve Lieber, and it is my pleasure to bring to you a series of conversations with some of the sharpest minds in health information technology. We'll discuss the smart directions healthcare companies and providers are pursuing to create smart care teams today. I'm joined by Craig Richardville. Craig is the Senior Vice President and Chief Digital and Information Officer at Intermountain Health, an integrated delivery network based in Salt Lake. As a member of the enterprise leadership team, Craig's responsibilities include leading all aspects of the health system's information technology and digital services involving strategy, applications, operations, information security, informatics, data, and analytics in leading the system's digital transformation and information automation. Prior to Intermountain Health, Craig served as Senior Vice President and Chief Information and Analytics Officer at Atrium Health for more than 20 years, where he transformed the growing company into a national leader in the effective use of technology, utilizing data as a driver and digital services as a differentiator. Welcome, Craig.
Steve's glad to be here. Thank you for the invitation.
You bet. It's good to see you again. So where I want to start out is at the executive level, and really want to get a sense of what's the mood today in the executive suite as it relates to health information technology, digital technology, and healthcare, that sort of broad area that is your remit. Yeah.
So when you look at the C-suite and what's happening across the industry, and certainly within Intermountain Health, there is certainly a serious look as to how technology can advance the services that we provide, the experiences that we offer. But as many of us have seen in other industries, but also it's not the panacea. It's not the only answer. There's a lot around people. There's a lot around processes. There's a lot of things that we've made complex within our system. So our CEO really is focused on simplicity. So the things that we do and the things that I'm being asked to serve and be part of really starts to lead us toward creating a more simple environment, a simpler environment for our caregivers, a simpler environment for our patients, a simpler environment for our consumers. And when you look at Intermountain Health and its legacy and where it still plans to head in the future, the vision of Intermountain Health is to be the model healthcare system. So with that comes the opportunity then to share the things that we're doing, the things that we're finding across the industry where it may fit for other populations that we're not privileged to serve, but others are.
Yeah. You know, you mentioned Intermountain and its legacy and its history, and it has been in the forefront of innovation in technology for my career. I mean, it's just always been one we look to. And so this question may not resonate necessarily at the Intermountain, but probably elsewhere of how has it changed in terms of getting buy-in at the executive level for the IT strategic plan? You know, what do you have to do? And as I say, it may not be so tough at Intermountain where it's always been a key part of their strategy, but you know, what is it that is different today? Is it easier? Is technology the first part of the conversation instead of the last? How has it changed?
Yeah, what I would say is technology, no matter how you define it, whether it's about the artificial intelligence piece or whether it's about even hardware components or all the pieces that go into the definition of technology, certainly all the software applications, it is part of the conversation. I can't say it starts with that or it ends with that, but it is also always considered as we make decisions. And when we look at those investments that we're making, I think for a lot of healthcare certain systems, but certainly Intermountain Health had an opportunity to play in some areas that others maybe could not or did not, given the clinical expertise, the markets that they serve, certainly the profitability that Intermountain Health has had in the past. But the industry over the last 3 years has got hit real hard. And it's a different mindset moving forward. Not being there in the past, but certainly being there now and plan to be for a long while, is really very focused on our goals, our initiatives, our mission of the organization. And so we have to have strong business cases when we bring things forward. Those business cases, we rank them in terms of some of the hard or soft savings or tier 1 or tier 2, however you're terming it. But we really look at to see, is this something that if it was my dollar, would I put it in? Would I get the return back? Would the experience change? Would our outcomes change? Would our financials change by investing that dollar into whatever initiative it is? But almost everyone has some component of technology that's part of it, some larger than others. And that's really what we look at. We really look at making sure that we're using the dollars wisely. We are an asset to our communities. We want to make sure that we're very thoughtful when we start making our investments.
Yeah. You mentioned, needing the business case, which obviously is the right thing, regardless of what we're talking about. I mean, you got to build the business case. I know you spend a lot of time in various places, not just there at your desk at Intermountain. You and I run across each other at various industry events like Vive and the Chime Fall Forum and places like that. As I hear the conversations, people over the past year or so have really been struggling with the financial environment in the provider setting. So what are you seeing across the industry and talking with your colleagues? Have we kind of weathered through the fear of recession and things are going to kind of get back to a better place? Have we sort of normalized? Is it going to get tougher? What's the outlook?
Well, if I had that magic crystal ball, I'd be a lot more crisp and accurate. I think right now we're kind of looking to see that this is going to be a situation that will be with us for the next 2, 3, plus years, certainly for the near term. And with that comes, opportunities for us to be a lot more focused and a lot more disciplined. When you look at the way healthcare may have been built over the past on the provider segment, as you mentioned, there's a part of it that our CEO shares. It was built on cheap labor. Half of our cost, or some places between 40 and 60% of our costs are people. And we are a people business. But with that, that piece is those labor rates have gone up. The opportunity to bring labor in has become a lot more scarce. So we have less opportunity to fulfill those positions that we need. And when we do fill them, the cost side of our equation has risen dramatically over the last several years. And so we have to start looking to see, how do we reduce the dependency? Not necessarily only to reduce the cost, but because the availability of those resources just aren't here. So if we want to maintain and increase the levels of service and care and quality that we have delivered in the past, we need a different care model of how we're doing it. You'll see that in other industries. You'll see us certainly leading and moving to how do we utilize technology to be able to improve our decision support, improve our efficiencies. And part of that's going to be, how do we engage our patients even more than what we have in the past and bring that patient engagement piece. I have stated that, in my opinion, the patient is the most underutilized resource. We walk our patients, we handhold our patients through a lot of, these are very, in some cases, life-changing events that we're dealing with people in some of the most emotional and dramatic times of their life. And so we do that. However, you've seen other industries start to shift some of that onto with the right tools and the right apps. So I am a bank clerk, several times a week, if not a couple of times a day. I used to go into the bank to do all that kind of work, but they gave me easy to use tools that are accurate, tools that allow me at my convenience to be able to do that work or do that service. And I'm happy to do so. Retail, the same way. All the full financial services, not just banking. So you've seen a lot of industries make that shift, and healthcare is primed now to make that shift. We have the drivers to, I would say, force us, but that gives us the challenge that we need to overcome. And that's going to be part of what we end up continue to build and to move forward with. And then the other piece I would say, Steve, and this is, you can't fight the advances that come into place. We saw that 20 years ago with the EMRs, and now, like you mentioned, everybody's got one, but there were a lot of people that, don't really want to go down that route. Now, nobody can escape without it, and all the education for years have now been included with electronic ways of how we automate and utilize our decision support tools. You'll see the same thing with artificial intelligence. So one thing I will say is that providers who don't use artificial intelligence will be replaced, but artificial intelligence will not replace providers. It's the combination of the person and the technology creating that process that will be our success. It's not one or the other. We can't do it ourselves, and technology can't solve it either. It has to bring it together. I tell people it's kind of like the GPS system. We used to try to drive somewhere, and I'm going to Steve's house. I'm going to get there eventually, and I may have to pull out a map and get lost. But now we just rely upon our GPS to get us to Steve's place.
Yeah.
Where historically, I'd just go ahead and I'd figure it out manually. Now that's just not an efficient way of doing it, nor accurate. And so we utilize me driving and the tool to get to a location. Same thing in healthcare.
Combination of technology and people. One really can't function without the other. Correct. As well as if they aren't together. So you just threw out a whole lot of stuff there to try to unpack. I mean, in terms of artificial intelligence, the history of the EMR and all that. So let me try to pull some pieces together there and kind of head us down that path of where we've been. So EMRs and say we can think back to a time where there was a rare number of you. You weren't there at the time, but Intermountains, there was a rare number of them that had the foundations, the beginnings of this. If I remember correctly, Intermountain had their own. And then, over time, it was more than the academic medical centers. And now, as I say, everybody. The way I picture it is, EMRs were a great collection of data. The key now is, in order to be smart, and this is where I'm headed with the question of how do we get smart? What is a smart facility? What are smart care teams? What are you thinking in terms of where you're going so that you do engage the patient better? You help clinicians drive better patient outcomes, all of those things that we know are the objectives, but it's the how to get us there that really is the question.
Yeah, I'm going to jump off to the back just to get a little bit of history for you. So, no, I was not at Intermountain when they one of the first in the country to develop and put an EMR in place, but it was called the health system. However, I was at a healthcare system called ProMedica Health System. And at that time, we actually worked with Intermountain. I remember flying back and forth to Salt Lake City, and we implemented the help system, which was the 3M help system that was created by 3M and Intermountain at ProMedica back in the day. It was primarily an order entry system, as you know. So I kind of was part of the first one, didn't develop it, but we actually used it back at that healthcare system, nearly over 30 years ago. Yeah. So amazing legacy that Intermountain has led. And when you look at the smart aspect of it, yes, we will be continuing to be a leader as we have for the last several decades into that piece. There's so much that's out there that needs to be tested and trued and brought out through. And it's going to be a combination of clinical and non-clinical. When you look at some of the advances that are coming into place, again, getting back to one of the financial questions at the beginning, we have a lot of back-end services that can be optimized. So some of these newer technologies that are coming out are being applied toward, we call it intelligent automation, but it includes AI, RPA, all these other acronyms are all part of that work. Over 2,000 projects that we have implemented as part of those services. And that's helping us make us more efficient, primarily on the back end piece. On the proactive piece from the clinical side, we are trialing, the virtual nursing. We're trying the surveillance that's happening within the rooms. We talked a little bit about some of the aspect of getting the patient more engaged by providing them easy to use tools, nudges by sending people messages. You got an appointment coming up. It's time to take your medication. Things that help people to be able to bring healthcare as part of their rhythm of life. whether that is in one of our facilities or outside of one of our facilities. And we all know, the audience knows, there's a big shift between what's happening within a four walls and what's happening outside. And a lot more of that work is happening outside. But we also know what's happening inside that is becoming a lot more critical. It's a lot more severe. It has higher severity levels. So the things that we are doing now inside, it creates even a lot more intensity of the work that needs to be done. Going back to the human piece, that we just can't rely upon and just hire more people. So we've got to put the machines within the rooms. We have to put those electronic eyes. We have to be able to work with people remotely. All those pieces are becoming part of that smart, that more knowledgeable way of how to take care of patients. We also have a big focus, maybe in my opinion, one of the biggest in the country, on value. We do take financial and clinical risk in certain populations with certain products. We are continuing to learn, so we can hopefully help perfect and teach how you work. But that's more the proactive side. That's for hopefully my children and my children's children, that they have a whole different way of how they're experiencing healthcare. Most of us experience healthcare on the care side. We get sick, we have to go get fixed. The focus now is, how do you do the health side of healthcare? How do you focus on keeping people outside of needing the need to receive care, or minimizing the amount of their care needed because you did early detection, or you're getting people with better lifestyles? You understand a little bit more about genomics and what's good for you, maybe slightly different for me, better on precision nutrition, all those different pieces that we hope that science will now become part of keeping people healthier and live longer, more fruitful lives.
Excellent. You mentioned a couple of things in terms of some examples of how you're using developing technology and surveillance and in-room monitoring, and that was one of them you mentioned. One of the things that I've sort of picked up on is perhaps a shift, and I want to test it with you, of moving from point solutions, we put a camera in the room, to more of a platform approach, which is, yes, there's a camera in multiple rooms, but there is intelligence laid on top of it to help guide us in situations of there's something going to happen in this room or happening in this room. So the anticipation, it's the generative AI types of things instead of just, a camera, so to speak. Little thoughts in terms of how you see those point solutions evolving into more intelligent tools.
Yeah, great point and great example. You're spot on. So obviously the camera itself is a hardware component. And what I try to educate people on is, as you start building the intelligence that uses the camera, don't tie that intelligence to the camera. So that I have to buy that camera to do this, because there'll be other intelligence software being built that just needs a camera. And if yours becomes proprietary as a product, as a standalone that need to interface, versus something that is a platform that is either already integrated or that I can easily integrate with other things, that allows me to be more effective, efficient with that camera. So historically, yes, the camera in the room for a virtual visit or a virtual caregiver, allows more, looks like you and I, more of a personal experience that we're going back and forth. The camera, typically can zoom in, zoom out. You can do calls with family members, but now that camera can also be used with the software behind it to kind of watch the room, to see where you are. That's surveillance piece. So you are now, leaning more toward the bed and you have a fall risk. I can now alert somebody because there's abnormal movement that's happening, or movement that I have sensed as part of using that hardware piece. The software behind it helps me to be able to do that. Similar to when people are doing some things with hand washing, it's monitoring the amount of time that a caregiver is standing in front of a sink. There's a monitor that the patient is, or the caregiver is actually washing their hands, not to that level of detail. Certainly it can sense movement and things of that nature. But the fact that you're standing in front of the sink for 30 seconds one could logically assume you're probably washing your hands. And so those kinds of things, so utilizing that one tool and making it a platform behind it so that you don't have to buy 3 different cameras to do each of those different functions increases the cost, the complexity, the ability for it to fail and break down. You got to have backups with the one, but I don't need 3 separate units. That's a simple example, but I think a very good example of how we have to leverage those investments that we've made in order to be able to provide more cost-effective and integrated or a platform level type of service, for our patients and for our caregivers.
Yeah. So you've talked several times about value and the financial picture and such, and I would expect, and I don't know what the count would be, dozens every week or more than that of new products, new approaches, and that sort of thing. How do you filter through that? Because as I say, I expect as a CIO at the level in the organization you see dozens, hundreds of different possible applications and platforms and different things. How do you separate out what isn't ready for prime time? What is? It's almost like, how do you not only filter, but where do you start?
Yeah. For me, it comes down to people, and the people is how I filter things in and out and through. So, for example, if something is presented to me, looks interesting, I can reach out to dozens of people within a matter of seconds. Has anybody heard of this company before? Has anybody used this product before? Has anybody done a tear sheet on this product before? Something that gives me some additional intelligence on that. So the networks that we have all created throughout our careers is a great way to try to look through that. We also have a venture arm. And so our venture arm looks at hundreds of companies, and they have great information, great intelligence. I can ask our venture arm because they have a different mission there. They're investing to get a return, not necessarily that investment may impact what Intermountain does. There's certainly some times where we overlap, but have you looked at this before? And if so, was it worthy of an investment or not? And if it was or wasn't, give me some of the factors and when that happened and that kind of stuff. And I can help be a little bit smarter when I'm having the conversation. And then when it comes down to actually who's behind the product or the service that we're looking at, what firm, what maybe venture or PE firm is backing it up that has made an investment into this company or into this person. Many people have great backgrounds that we can learn to see how they've been successful or not successful. So I think really it's just that networking of looking at, the people that we have worked with over the years, looking at inside Intermountain Health, and also looking at the people that's behind that product or service. Whether I'm buying a product or buying a service, to me, it still comes down to people. If I have to revert to a contract, that means that you're a vendor, you're not really strategic. We just aren't able to work together that well in the future. But in most cases, you're really able to talk to people and figure things out rather quickly, because there are a lot that are coming this way. But once you kind of get on the list that it is something that's positive, or you get some feedback that leads you that way, that will lead me then to let's get on this thing, as soon as possible, given our capacity constraints and things of that nature. But we do really quickly be able to bring things in and ascertain the value proposition that they're bringing, and can we help expand that for our populations? And again, is it applicable that we could then share to others? And I get those pings all the time too. So it's really a really nice networking piece. Yeah.
We started off talking about buy-in at the C-suite executive level. Let's go to the other end and the front line. What are you sensing today in what it takes to get buy-in at the frontline level for change and innovation?
Yeah, we're we really rely a lot on engagement. We really look to make sure that people understand the reason that they're here, that they have input to the things that we're doing, that they're engaged, involved, versus maybe some people or places that look at people more like contractors, like you're replaceable. And I just need that, that talent, but I don't really need to have you be part of our family. And I like looking at it kind of more as a family type of thing. Like we're all in it together. I've got your back, you got my back. You tell me when I'm making a left turn, I should be a right. I'll tell you the same. Let's just make sure that we kind of work at this together. So for me, it's really the engagement piece, making sure that we are open, that we're transparent, that we're truthful, that we're as proactive as possible. But you also are part of the solutions that we're developing. You just don't throw a problem over the fence. You're part of getting that problem resolved and pulling in the right people to work all your way through. We can't do it ourselves. So we really need people who are doing a little bit more of the hands-on work to be fully engaged and to be empowered to be able to bring things up to the right people at different parts of the organization or outside the organization. They've got that capacity, that talent, that skill set. They don't need permission in order to do it. They need to go ahead and just take the proactive stance and engage. And that's really, for me, is a big thing, is making sure people want to be in our part and contribute to your success.
Yeah, I really like that. Engagement and empowerment. You really are telling me my participation has value. I can contribute value to this. That's great. You gave in a sense an answer that was a great piece of advice, and that's about professional networking a little while ago, in terms of trying to find out, has anybody else heard of this, done this, that sort of thing. I want to close with, your practical piece of advice. So, the crowd that are our listeners are CIOs, CMIOs, CNIOs, and such. So what's Craig got to share in terms of your experience with this that you think might be of value to them?
Yeah, I guess there's maybe a couple things. The first thing I would say is, if you think you know it all, then you don't.
You don't.
Right? You just gotta be humble and just realize that you don't. Many of us learn that really fast, hopefully earlier in your in your career than others. But once you realize that, then you realize, okay, now I really need to network. And I do believe networking is where there's a lot of things that are out there. I not only belong to the network of healthcare and been engaged with healthcare for 30 years and have a lot of people I rely on that are still working, and some not working anymore. Some have moved to even other industries. And that brings to the next piece. I also look a lot outside. So maybe for the last 10 years, a lot of my growth has been outside of healthcare. And there's a great organization called Inspire CIO. They just had actually their annual event last year or last night. In that event, I was their first healthcare, CIO of the year that went across the industries. The year after that, which was Chris Ross from Mayo Clinic. Then last year it was, last night it was a lady from the payer side of healthcare. But what I interact with people that are going through all piece healthcare maybe is 5-10% of that group. And so getting involved with those, because I've referenced banking, I've referenced retail. There's so many other industries that have great solutions that aren't specific to healthcare that could assist, or you could reapply to it. So going back several years ago, in a previous life, I was talking with the CIO of an energy company, and we were just out. There were 10 of us that gathered every month, and we were just sitting there talking. I was like, how come you send me all this stuff about energy, about, putting in the insulation, changing out my lights to more efficient lights? So like, don't you want me to pay you more? And you're encouraging me to use you less. It was like, we really want to conserve the resources that are out there. We're really in it for you. We don't want you to pay unnecessarily. And it really became kind of almost like a value proposition, what we're doing in healthcare. And he says, oh, by the way, when we send you your bill and we do care about you, you have a propensity to pay much higher than where we're just sending you a bill and going to send you to collections if you don't pay it. It was like, boy, we're going to take that same thing and put it on our statements. Here's you have an appointment coming up. You're overdue for your mammogram. Things that really are meaningful, and we do care about you, to put that in. People want to then now become part of your healthcare system and receive their services through you, because there is this two-way communication, and we want to help you just as much as you need to be part of our healthcare system to receive the best care possible. So I really think the networking piece is invaluable to how the answer is in the room somewhere. You just got to be bold enough to ask the question, and people will offer it.
Yeah. And as you pointed out, sometimes it's in a different room than you think you ought to be looking.
Yeah.
That was a great comparison there with the energy world in terms of making sure that the patient, customer, feels valued and that you care for, their interests are your interests. And that absolutely carries over to us here in healthcare. Craig, great insights. I really do appreciate you being with us today. It's always a treat to see you and chat with you. And I really do appreciate your contributions to Intermountain and to the healthcare industry at large. So thank you very much for joining us today.
Thank you, Steve. And I will say, you have a wealth of information and great experience. I hope one day I'm able to interview you because you have so many answers you could share and help the audience. It's a pleasure.
It's been a great career, and I've had a lot of great conversations and learned a lot from folks like you. So thank you.
Thank you.
And to our listeners, thank you for joining us. I hope this series helps you make healthcare smarter and move at the speed of tech. Be well.
Thanks for listening to Smart from the Start. For best practices in AI and ambient intelligence and ways your organization can help lead the era of smart hospitals, visit us at smarthospital.ai. And for information on the leading smart care facility platform, visit care.ai.